I am Chantal, and my project is on food-related outbreaks of infectious diseases. Food-related outbreaks that cause infectious diseases are the result of food contamination, which is a serious public health issue. I plan to further research this journal article to elaborate on how food contamination affects health by explaining symptoms and the implications that are likely to arise as a result. I will also explain the origin and causes of food contamination to give my audience an understanding of how food-related outbreaks begin. Based on a different journal article, I will dive into the history of this issue so people can see patterns and the relationship between outbreaks back then to today. I also plan to further research the clinical aspects of this issue through another journal article that is listed below. In this section, I will explain a treatment that creates a lot of controversies. This is the topic of antimicrobials, or antibiotic drugs, that are used to treat and prevent bacterial diseases found in animals and food. Such bacteria can contaminate the food we consume and lead to a foodborne illness and outbreak. The opposing side of the use of antimicrobials is the idea that it can cause the development of antimicrobial resistance and negatively affect public health. I will then further elaborate on each viewpoint and argument with evidence to support each side. I will research guidelines and recommendations around this issue from different agencies or organizations. One organization I plan to look into is the WHO, World Health Organization. My issue as a whole, I plan to research the viewpoint that surrounds the idea of why it is detrimental to society. The other viewpoint I plan to research is the idea that food-related outbreaks of infectious diseases are beneficial for society because it helps control population sizes. I will identify these key arguments and provide evidence to support each statement. Lastly, I will research any recommendations regarding this issue. Socially and culturally, outbreaks have occurred as a result of inadequate practices in the production process. This contributes to the controversy of this issue because it can cause people to feel unsafe in the hands of people who control society. I will further my research on what I previously touched on, and additionally, I plan to research the economic, political, and other factors that contribute to the controversy of this issue. Any relevant guidelines or recommendations about these factors will be researched in order for my audience to understand the steps that can be taken to improve food-related outbreaks of infectious diseases. Lastly, I plan to discuss how the factors listed shape the different viewpoints mentioned earlier. A quote I found states that foodborne illness is a preventable public health challenge that causes an estimated 48 million illnesses and 3,000 deaths each year in the United States. Individually, one should regularly wash their hands, avoid cross-contamination, cook through proper temperatures, and store food properly. I plan to elaborate more on this. The FDA investigates outbreaks to prevent more people from getting sick and to better the future of food safety. I also plan to elaborate more on the FDA and how this organization addresses this issue. Next, I will explain how the government addresses food-related outbreaks of infectious diseases to further develop my audience's understanding of this topic. I will then address the societal and organizational responsibility to promote and advocate around this topic. Society should support food businesses by ensuring safety, which will in turn keep the people within the community safe from food contamination. Organizations should promote guidelines that any business in the food industry should follow. Lastly, I will discuss the ethical considerations and constraints that might arise when attempting to advocate for this issue. Businesses may find that their privacy is being invaded, which is a key restraint. Overall, food-related outbreaks of infectious diseases poorly affect public health. It is likely to result in a number of complications, one being death. Outbreaks are very fatal and will affect millions of people once spread throughout the world. It is important that the government, organizations, and people individually help combat and prevent any outbreaks. Businesses that are involved in the food industry need new guidelines to avoid mistakes that can result in infectious disease. Ensuring the safety of society's food is vitally important to keep people healthy. And these are the references that I've used so far.